Guys, let's kill this.
Why do I only see 4 people?
Zara has become so techie, eh? Look at that.
No, I can't believe it.
Streaming a meeting. Say that. Did you know how to do that?
I have no idea. I barely know how to use my iPhone.
Marzia Auntie's not back yet. That's why there's only.
Why do I only see 4 people?
Zara has become so techie, eh? Look at that.
Oh,
I can't believe it. Streaming a meeting. Say that. Did you know how to do that?
Am I the only one that can hear that?
Yeah.
No, we all heard it.
Because there's a delay.
Okay.
So
are we gonna hear ourselves after we've spoken?
We shouldn't.
Oh no.
Because I just muted
Hope not.
myself.
That's gonna be weird.
Yeah.
Okay. So I'm gonna. Are we all here?
Marzia Auntie's here now too.
Yep.
Okay. All right. Perfect.
That reminds me, let me grab my water. I'll be back.
So tell me, is the light too bright? Is it okay?
We're actually on.
When I was asked to speak about mental health and exercise, I was completely drawn to it right from the beginning. It is a topic that hits very, very close to home for me. Growing up, in my childhood, I experienced challenges, tribulations, and trauma that led to me seeking therapy to help heal my PTSD. Because beyond our physical health does come our mental health.
So my brother just called me and says that he can see us and hear us right now.
So I think everybody can hear us and see us now. So let's get started. Assalamu alaikum, everyone.
Walaikum salam.
Okay, Sayeda, take it on.
All right, so I'm just going to start with our little intro right now. So I just want to say salam and hello to everybody watching. My name is Sayeda. Everyone will introduce themselves as they go, but welcome to today's mental health table talk. So essentially, the goal of today is to talk about the various aspects of mental health. And we are here today with a group of powerful, passionate women in their respective fields of work to discuss topics like identifying the signs of mental health in itself, different mechanisms to cope with it, how the gut is interconnected with mental health, faith and spirituality, and last is physical activities and the role in mental health. And the goal essentially is to normalize this conversation around mental health and, more importantly, to continue the conversation through events like these. So now I will pass it to Zaranti, aka Mama Khwaja.
Thank you, Sayeda. Thank you for your bravery, in sharing your journey and with everyone and bringing awareness in your generation. I know we do a lot of talking in our generation, but what is very, very important right now is to for the youth to be a part of the conversation. In the opening, I shared a small clip. I don't know if most of you got to see it or not, but that clip was from a video that Sayeda had shared at 786 Counseling on Instagram. And I will share, and I had shared it in my stories before, but I'll reshare it at the end of our event today as well, for those who would like to watch it. It is hard to talk about mental health, but it is definitely not impossible to do that. And so today, that's why we're here. And I hope you've baked your banana bread and you have your hot cup of coffee and you're here. The fact that you're here, and ideally, if you're here with your family and your loved ones, that is the most important thing. So joining me today are Marzia Hassan, a family therapist and a marriage counselor, Zainab Fazal, a behavior analyst, Kaniz Amir, who is a conscious transformation coach and a meditation guide. And Kaniz, thank you so much for being here today. Everybody else, but more so for Kaniz to be here and make time. Aziza is a registered pharmacist and a holistic nutritionist, and Zainab Akbar is a personal trainer. So when I was doing my research on the topic, I came across stats like in a given year, 1 in 5 people will personally experience a mental health problem or illness. And approximately 8% of adults will experience major depression at some time in their lives. By the age 40, about 50% of the population will have or have had a mental illness. So Marzia, can I ask you to define mental health? What exactly does it mean?
Okay, so Assalamu alaikum, everyone. To put it very simply, we always say mental health. What does it mean exactly? So to put it very simply, it simply means, how are you feeling? Are you feeling okay? And so, one of the things that we need to recognize is that when we talk about mental health, it is on a spectrum, right? So on one end is a severe mental illness, such as, it could be a personality disorder, it could be a significant mental illness which needs medical attention, right? And on the other hand is what we call mental well-being, means that you are thriving, you are flourishing. And part of the issue has been in the field of psychology that up to now, until very recently, psychologists and therapists have only focused on how not to get people depressed. Like if they're depressed or if they have a mental illness, how to get them to function, right? However, what is much more inspiring and something that we can all work on is how to flourish, how to thrive, how to be at our best. And that is something that all of us, whether or not we have a mental illness, whether or not we have depression, anxiety, or other diagnosed mental illness, that's something when we talk about mental health, we can all work on that. So I hope that makes sense.
So is it safe to say that it is a complex interplay of genetic, biological, personality, and environmental factors that cause mental illness? Everybody, your thoughts?
Yeah, it's definitely, I think it's a holistic approach. That's why I think it's important, and I think in the medical community, we've been kind of, we've taken the wrong approach. And I think things are changing now is because we've kind of looked at it as just, just treat it one way. But really, like you said, it's an interplay, right? There's environment involved, there's gut involved, there's genes involved. So a holistic approach definitely is what's needed. So I think, I don't know what everybody else thinks, but I think it's definitely, in my opinion, it's definitely an interplay of a lot of factors. And that's why you can approach it from so many different directions. For one person, it may be just one thing that needs to be fixed and you're done, right? And then you feel much better. But for others, it may be a whole bunch of things that you need to work on.
Yeah, because I think it's I think it is a little bit genetic too, no? Marzia, what do you think? Because I know that in my family, on my mom's side, there is like a bit of, depression. And somehow like I feel like sometimes I go through this where, I'm doing really well. Everything is, great. And then all of a sudden you just feel like this pull from the inside. And then you sit there and think about, okay, but like, why am I feeling this way? So do you think that that's something genetic?
So those are, I think, two different questions, right? One is that whether it is genetic, and for sure, there are definitely, families that are predisposed to it. And it may not be genetics. It could also be what we call multi-generation trauma, for example, right? So if people have been going through stuff, it could even be things outside of us, like racism, for example, violence, immigration. It could be so many things, right? When people have gone through that and have not had the language to talk about it, to get help for themselves, or even to language it, right? Even to express it. Obviously, it is going to go down, the generations, right? So definitely genetics is one part of it, but genetics, again, I think Aziza mentioned epigenetics, right? What that means is that you may be predisposed to something, but your genetic expression is not predetermined. So even though you may be predisposed to it, you can definitely do things. You can help yourself so that your genes, and it's the same thing with diabetes, with any other physical illness as well, right? Just because you've had a family history doesn't mean that you're going to get it. It just means that you're at a higher risk.
And I guess sometimes it just becomes like it, right? Like you just throw in the towel, or you just kind of give in and say, it is in my genes, I'm going to get it. So you don't want to make that effort to change. And that's why being more aware about it, I guess, is important, right? And then taking those steps. So if I know I have diabetes in my family, I'm not going to indulge myself in having lots of sugar stuff in, right? So I guess a mental state would probably be the same thing. Another fact that I came across was that it is estimated that 10 to 20% of Canadian youth are affected by mental health illness or disorder. And anxiety disorders affect about 5% of household population, causing mild to severe impairment. So Zainab, with so many people going through this, how does one support someone who they love is struggling with some kind of mental crisis?
Yeah. So just to start off with, like, research supports, right? So anybody dealing with anything, and like Marzia talked about, like the spectrum. So you have got like the, mental well-being, right, in general, all the way to the more severe end of the spectrum. Research supports along that entire spectrum. When you've got friends and family that's supportive and that's there to help you, that those people are going to fare a lot better. And so it's really important to be able to have the skill set to be that support system. So there's so many different ways you could do that. I think the two most important things for me is just learning the skills so that you can be actually supportive, empathetic, encouraging patient. And when you're dealing with mental health issues, there's this really fine line between being supportive and being patronizing. So if anyone's ever come across somebody and you're talking to somebody and they say something like, well, you can just step out of it, like that doesn't work, or why is this happening? If I had the answers, I might not be where I'm at right now. Or you used to be the life of the party, right? So statements like that can be really demeaning and full of guilt for the person who's receiving it. So in terms of that fine line, make sure that, the unsolicited advice, there's no room for that. There's no need for that. Like, ask the person, like, be straight up and ask the person, like, do you want my help? Do you want me to tell you what I think? Or do you want me to just listen to you? Right? And I don't think that we do that. We think about it from our own perspective versus the receiver, and in a conversation, you've got a receiver, you've got the speaker, you've got the listener, you've got all the noise around of everything that's happening, and then you've got the message. So learning the skills to be a really, really good listener, I think, is quite possibly one of the most important things to provide that support, right? Don't compare your life when you're talking to them. Oh yeah, but like if someone shares something with you, oh yeah, I remember a time when I, like, don't do any of that stuff. It's not about you right now, right? It's about them completely. Always meet them where they are, not where you are, because you might be, Mama Quadra, you said earlier that like things are fine and then you go on to this thing and then everything's good, but you kind of feel down, right? So when you're talking to somebody who's going through that roller coaster, has like that little down phase, then meet them where they are, right? Not where they are, not where they were a week ago or even a day ago, right? Because it fluctuates. Mental well-being can fluctuate all the time. Be really conscious. If you're going to make comments, comment on their actions and choices, not their character, right? So the mental illness is not what defines them. They're a person with anxiety. They're a person with depression right now. They're not a depressed person, right? So even just changing the language around is really important in terms of how they identify with themselves. Check yourself, like, where are you coming from? What are your intentions with this person? Right? Are you there to actually just listen and help? Or are you there to have like that one-up type of conversation with them? And when you are listening, be really careful and aware of your nonverbal communication, right? So if I'm like looking around doing all of this stuff, that person is gonna be like, well, she's not really interested. She's bored. I'm burdening her. So be really mindful. Those are ways to support them. So, and being present, really, really look into how you can do that. The other way you can support someone is to do some of their tasks for them, right? And I know this sounds like it could be meaningless stuff, or it could be just like smaller tasks like, hey, I'll make the appointment for you. And kind of remembering that when somebody is dealing with a mental health issue, right, whether it's diagnosed or kind of on the lower end of the spectrum, some of the tasks that we think are really easy to do, right, might seem really overwhelming to that person. So offer types of help and support that don't endorse or let them, it's not about fixing a person, and it's not about doing everything for them so that they can kind of remain in that state of depression or anxiety or whatever. It's about just making their life just a tad bit easier. So if you're going groceries, call and be like, yo, I'm going groceries. Can I pick anything up for you? Right? And it's not about,
or can I pick you up? Do you want to come with me for grocery shopping?
Absolutely.
I think that would just get them out of the house, right? Like just little things, which doesn't kind of really make them feel like, oh, she's, it's not like in the face kind of thing. It's just like, hey, I'm doing this. Do you want to come along? Right?
Yeah. Absolutely. Don't stop inviting them or stop doing stuff just because they've said no. Your job as a support person is to be part of their healing and wellness, right? It's not to hold their hand. It's not about fixing somebody else, because you can't, right? It's about, what can I do to make your life somewhat easier, whether it's in this moment, in the long run, whatever it is. So offering those types of support. And I know I could go on and on and on of ways to support it. I'm sure you have questions.
No, I mean, these are all very, I think, practical things, and very, like, sometimes we, like, at least I think, I don't know if you all agree or not, but like, I feel like they seem like such small little things that we were like, oh no, like but it's that small little thing that appears to us as something, such a big gesture to somebody, right? Like if you just kind of sometimes out of the blue call them, or to say, hey, you know what, let's go for a walk, or I was just passing by, here's your favorite coffee, right? Those things just make you feel a whole lot validated when you're feeling so down. So no, it's I think it's so important, and especially when you're down. I think there's a quote by Imam Ali that says, when the world pushes you down to your knees, you're in the perfect position to pray, right? And that's where I think I'm going to ask Kaniz, like, how can one find comfort with God, right? Like during a mental health crisis, right? So when you're really feeling low, everything that Zainab is saying, like there are people who can do all that little things for them. But then when you're in the presence of God, how can that help you?
I think also, your relationship with God is so important. Many of us have a fear-based relationship with God, where we feel like he's constantly judging us, or he's out to get us, or, he's going to throw challenging situations at us. And I think just shifting that perspective and seeing God as only love, like just unconditional, unlimited love is like the greatest thing you can do for yourself, because God is within you. He's not, he's not outside of you. He is within you, in your heart. And just really understanding that he's only there to love you and to give you whatever is best for you. And also, everything that is around you, like even the earth that we live on, right? It's so loving. Like if we can just consciously connect to the earth, like as we're even just walking, going out for a walk, being in nature, how loving does that feel? It actually shifts the way we feel. Like it brings this sense of inner peace and tranquility within us. Every step, like the other day, like I'm going through something heavy in my life right now. And just the other day I was walking outside and I felt like the earth was just, caressing me. Like with every step that I took, I just felt this immense love just come within. And I think when we're going through these challenges, the only thing that can heal us is love, and God is only love.
Yeah.
So
You know what? Like, if I can ask all of you this question, like, and I've asked different people, like, if you close your eyes and you like, and I mean, my image of God is very different now, but I used to say this: if you close your eyes and if you can visualize God, what would God look like? And my image of God always was this old man in a dark place with a long beard and like a stick and this very serious look on his face. And I know, like, and that was my image of God. And always fear-based, you know, I think growing up, it was always like, if you don't do this, Allah will punish you. If you don't do this, but there was nothing, oh, if you do this, Allah will shower you with love. If you do this, you know, or Allah loves you. So you know how you have that fear of the police car? You know they're your protector, but the minute a police car comes in, your house starts pounding. And you know, you're like, oh my God. Even though they're just passing by, they're just having their coffee. Even if it's like a drive-through, you're just making sure everybody's. So
they see in you, Zainab.
So it was funny, but I mean, so to me, I've shifted that image significantly. And I had the conversation with my children a lot. Like, you know, when we're talking about God, I'm like, he loves you. He wants to take care of you. So make Allah your best friend, right? And that is a one entity or one energy or one being that will never, ever leave your side. So no matter what, no matter where you are, just close your eyes and connect to Allah. And I know it's easier said at this age, at 40. I mean, you're talking to teenagers, right? But Sayeda, do you think that you know, you grew up with that image, and do you think that that's shifting a little bit or no?
So just a little funny story as context. Just growing up, I used to do this thing after every namaz. I would pray beside Amma, in between Amma and my sister. And just after namaz, I would go down to sajda. I would just, you know, pray, always just, and then I would kiss them more, and I'd say, love you. Say, love you. Love you. So I would just always just, and like Kaniz Auntie was saying, is that, you know, God is love, and without our heart, which is our love, we don't exist. And something that my dad has recently been teaching my siblings and I is to have a God-centered lifestyle. So you could be Muslim, you could be Canadian, you could be this or that, but don't forget that God is the center of your life. And, you know, like, I'm learning that slowly. And as long as I can remember that, then, you know, I think he has my back.
Yeah.
As long as I continue to love him.
Imagine, like, for me, I'm realizing this as I was nearing 40, and mashallah, you're just in your 20s. So imagine you have such a good head start, right, to that relationship with God, right?
Yeah.
And I think if you, like, you know, if you do it and you share that same thing with the people around you, so they will benefit around the same time, right? Like, and then the growth is just immense, I find, right?
Yeah.
So a lot of people are unaware of the relationship between the gut and mental health. And I am one of those people. Like, I hear it, but I'm like, yeah, whatever. That's me. Like, how can food or my gut be related to my mind? So Aziza, how is it possible that the connection of the gut can affect your brain health? Can you explain that connection, please?
Okay, so it makes sense why a lot of people don't know about it, because this is a fairly recent, I think, discovery, I would say, in the last decade. You know, we've always known that one of the things that I guess we've done in the medical community, we've kind of separated the mind and the body. And that's probably one of the biggest mistakes, because really they're connected, right? But we did know all along that the brain controls the gut, in the sense that, you know, if you're stressed out, you know, I'm sure many of you have experienced, you know, you kind of like, if you have to do a presentation or whatever, you know, you feel nauseated, you don't want to like eat. I used to always feel that. And so we always knew that for a while, that the brain connected the gut, right? So if you're stressed out, you weren't feeling well in your stomach. What was a recent discovery is that connection between the brain and the gut is bidirectional, which means that not only is the brain telling your gut what to do, the gut actually tells the brain how to feel, which is a discovery that probably I would say in the last decade. And if you don't really know about it, if you Google gut-brain connection, there'll be so many hits, because that's been a really big area of study. So what they found, there are a lot of studies in animal studies, but there's some in humans as well. What they found that the condition of the gut can actually lead to anxiety in the brain. So there's a mice study that they did, and they induced inflammation in the gut. So when I say gut, it means the intestinal, like the digestive tract, right? The large intestines, the stomach, and the small intestines. So they induced inflammation in the gut in these mice. And what they found was the amygdala in the brain, which is a structure that's responsible for fear, anxiety, all those negative emotions, that was hyperactivated, which means that the mice were now feeling anxiety because their gut was inflamed. And so and there are many studies like that have shown that, the changing in the gut, and that's not just even the inflammation in the gut, you've got, and the new, I guess, the addition to this whole gut-brain connection is the microbiome, which is the bacteria that live in our gut. And that's another like big explosion of studies here that are talking about if your microbiome is out of balance, that can also lead to a lot of mental issues. And I'll give you an example. This was a few years back. I had a patient that actually developed diarrhea. Like, she was having on and off diarrhea, right? And they weren't able to, doctors weren't able to figure out what was going on, so that she was going through tests. And then the next thing I know, her husband comes to the pharmacy with like a prescription for an antidepressant. And I'm like, what's going on? She goes, I don't know. She's never had this, but suddenly she's feeling really down, and the doctor put her on antidepressant. And so we sort of worked with her gut and, helping her with that. But once the diarrhea resolved, within a few months, she was off the antidepressants. So it was totally connected, right? This was like my first-hand experience. I saw someone with a gut-related issue just end up with almost like a mood disorder, which she's never had. And it resolved as soon as, so there's a huge connection. And I think it's important to understand, like I said, it's a holistic approach, right? It could just be, for some people, I mean, we're all biochemically different, right? So for some people, it may just be the gut. It may just be, what we're eating, how we're eating, all that stuff that can have an impact on the mental health.
So do you think that so what we're eating, how like our brain releases some chemicals and all that things, and everything. So do you think that whatever we're eating, whatever we're consuming, and our gut is processing, like in whatever, that is also like all connected with the chemical imbalance in our brain? And then that's how, like, I guess we feel, because I know, like, so I've been asked to go gluten-free for a while because I have Hashimoto's and whatnot. So I was like, oh, I can't give up my breads. I can't. My bread and butter first thing in the morning with my chai is like my thing. And so finally I said, okay, I need to do this. Now let me try, right? Let me prove everybody wrong. There's nothing to do with that. And there's no such thing as gluten. So I reduced, I didn't stop, but I reduced my gluten intake. So, and then I have like that moment of weakness when emotionally you're not feeling the best. And then you're like, oh, I'm just going to indulge myself in like my comfort food, which is toast, butter and toast, right? Lots of butter. And I had that. And then all of a sudden I could just feel like I was feeling different, right? From where I was eating less gluten. And that was like a new discovery for me. And I think I used to always feel that heaviness and the lightness. So then I could differentiate. I'm like, damn it. It's like, wow.
That's why
food mood disorder, like a food mood diary. So eat the food, like, to keep it, like you said, when you did that, you realize, oh, there's a, because it doesn't always happen for everybody, right? Everybody's different, right? But for you notice. So that's why a food mood diary is an excellent way of knowing if certain foods are affecting you.
Sorry,
right?
Marzia, you were trying to say something there?
So I was just saying that's why the way we eat is MAD, M-A-D, the modern American diet, right? M-A-D is actually crazy. It's not designed for human consumption. And definitely, if we change the way we eat, whether or not our mood improves, of course, physical and mental health is also related, right? So, just even, between supplementation and the way we eat, it's a huge part of it, right? It's not a small part.
Yeah. And of course, physical activity, right, Sayeda?
Yeah.
So like you mentioned in your full video, if you guys haven't had a chance to watch it, Sayeda's talked about how physical activity helped her get through her mental crisis. So could you explain more about how using physical activity helps one?
So I don't want to get too personal. I want to make it more of a general idea for people. But physical activity in itself is a powerful medicine, I would say, for many mental health challenges. So physical activity could mean something as small and simple as going for a walk, like a lot of people do, including myself, like something as simple as that, or, obviously like lifting weights, jogging, biking, like these are all different ways to move your body. And what the physical activity does is it releases these types of chemicals in your body called endorphins, which are essentially called feel good chemicals, right? And it helps you to continue to be active because it helps your mood, it helps your anxiety, your depression, and those types of feelings that you're feeling. And I think for myself, personally, that's what it was, you're in a dark space, you're in a little bit of a tough situation, and moving your body, feeling better about yourself by going for that jog or going for that walk, because before going for that walk, you couldn't do it. You just wanted to sit on the couch and you wanted to sulk over something, which is fine, but it's about getting yourself past that and understanding that perseverance and that struggle leads to success. But it's about wanting it, and it's about understanding how you're in the now, you're in the present, but you also seek that future better self for yourself. So
yeah, so basically you're allowed to feel the feelings, right? Like when you're feeling that way, don't be hard on yourself and say no, you can't, right? I guess you can take that moment to acknowledge the feeling and feel the feeling, and then I guess then process, right? Okay, where and not everybody will probably draw strength in all aspects, right? So eating right and meditation and working out, and so I guess, but wherever the one thing that you can, that connects with you or brings you out of there, and then slowly you can, I guess, grasp all three. Yep. And that would be like the perfect ideal thing, right? Like 100%. If you are able to connect spiritually, and that you take everything and try to heal yourself out of it, and then be in a better space, and then just kind of maintain it, right? So same way physical activity helps you lose weight, and then you can maintain it. Mm-hmm. I guess same way, right?
Yeah.
Is that right?
Exactly. I would say so. I think then again, right, then you can have another bad day, and that's okay, but you understand that perseverance, and you understand that wavelength of up and down in life, and good days, bad days, your anxiety might go higher because of school, for example, or because of work and things like that, right? But understanding that it takes more than just sitting around about it and actually doing something, right? And that's when you can get the help or talk to someone or be part of events like these, and vocalize how you're feeling for the first time. And it took me years to do that.
Yeah. Or like Zainab said, if you have that support system, and if you know somebody who's going through it, and okay, she might benefit from a walk, or she might just benefit from a nice meal, right?
And then like you said, like actually going with them, like, hey, do you want to go for a walk?
Yeah.
And I know we've done that before too.
Or meditation too, or connecting, or just having that, pick up the phone and have that phone call, or directing them towards the right type of help that they really need, whether it's, therapy. And I guess that's where, like, I would say that, the stigma or discrimination attached to mental health illnesses presents like a serious barrier, for people to either get a diagnosis or even a treatment for that matter, right? So, and that, I guess, that acceptance that you're looking for. So because there's so much stigma and all that around it, that you just kind of quietly suffer. And, almost one half of those who feel they have suffered from depression or anxiety have never gone to see a doctor about it, right? So Marzia, like, what kind of help is available for people like that? And like, who should one turn to?
Yes, so I think it really depends on what the issue is, right? Like we said, there are so many variants of mental distress that it really depends on what you're going through. If it is, for example, a significant issue in the sense it's beyond just feeling down or having a little bit of anxiety, when we're talking about mental illness, obviously it's a whole gamut, right? I mean, there could be personality disorders, it's schizophrenia, it could be a whole variety of stuff, right? And for the very serious things, you do need a psychiatrist, right? A psychiatrist is a medical doctor who can diagnose and give medication and all of that. So that is, I would say, again, when I'm talking about the hierarchy of mental health professionals, I'm talking about in terms of degrees and education and all of that, right? So I would say that that's at the top, and below that is a psychologist. A psychologist is someone who spends most of their time doing testing, actually, to see what help you do need, and they work in the school system or in a professional setting, and that's those are they're not medical doctors, but they are, I would say, one level. Again, they have to go to school for many years. Most of them would have at least, most of them would even have a PhD, more than even a master's degree, right? Then underneath that are psychotherapists, mental health, who do talk therapy, right? People who do talk therapy, they're not allowed to diagnose, but they engage, but they have training in recognizing significant issues, so that if you can't deal with it, you know who to refer them to, right? And then underneath that, so all of these are highly regulated as well. Regulated means that they're answerable to people, they have their own colleges which have codes of ethics, they have a system of working, right? And after that, it gets much less regulated, in the sense that, from talking to a friend, a spiritual guide, like, an imam of a mosque, or, your local pastor kind of thing. And in between that come coaches, right? Now, coaching is a new industry. It's not regulated, and you could have, basically anyone can call themselves a coach, right? It doesn't mean that they don't help. I'm just talking about what the regulations are. And whoever you're working with, the bottom line is that the most healing thing is the relationship that you have with your helping professional. So whoever you're speaking to, when you're choosing somebody, don't be afraid of asking them, what is their background? How much training do they have? Are they supervised? Have they dealt with issues like this before? Like, you have to, be a little bit of an advocate for your mental health yourself. So when you are, and again, what I tell clients as well is that if something's not working out, if your relationship with your therapist is not working out, don't give up on therapy. Give up on that person and choose somebody else. But don't give up on the fact that you need help, and that sometimes you have to go to 2 or 3 people before you will find somebody who, is providing you that relationship where that relationship of trust and care and compassion, where you can begin to heal.
And I think that, like you said, to find that connection, there might be like the top therapist, right? But if the personalities are not jiving or whatever, that doesn't mean that, okay, this is not good for me. That means just this person, like, we're just not connecting. I feel like, I mean, if I've been for therapy, and I feel like the thing that I was looking in a therapist for myself was, somebody who can understand our cultural and a little bit of a religious values too. Because I think that plays a very important role, right? And I don't know, like, as a younger person, Sayeda, once again, I'm kind of going to throw it back at you. Like, right? Do you feel like sometimes just going to a random person, like, I know it has to be a balance, right? So we cannot completely push somebody who's religious or too much from a culture. There has to be a little bit of a balance. But I know for myself, like, so they would understand me a little bit better. No? Am I right? Thoughts, everybody? Or say?
I think for myself, it was easier to be with someone who wasn't necessarily from our culture per se, because unfortunately, we have stigma around South Asian girls, like, don't worry about it, like, it's not that big of an issue, or like, sorry, I got kind of quiet. It's just, things like that, like things that make you feel inferior and make yourself believe that, it's not true, you don't feel what you feel, whereas going
Or
to
it's all in your head, or you're
Yeah.
making a big deal about it.
yeah,
But
why would I go to someone who makes me feel like that? And I think that's why for myself, having someone who understands religion, who understands culture, but has a different take on it, that can give me more than just it's all in your head sometimes, is super valuable and beneficial.
So I think on the other end of the spectrum, right, again, it's about a good therapist will have training in dealing with different backgrounds and different ways of being, right? On the other hand, for example, if you go to, and I strongly believe that you can have a great relationship with a therapist who's not from your culture, and it really depends on your level of comfort and on the therapist, right? You could also go to a therapist who will look at you, and think, oh, she is, put you in that box, that she is an oppressed person wearing a hijab from a South Indian, background, right? So it could be, what I'm saying is that it doesn't really mean that if you go to somebody outside your community that you will find more support, just as the opposite is not true either, right? And that's why you actually have to maybe try a couple before you find somebody who is
Exactly.
who
And
you can work
I
with.
think it's all the onus of the therapist or the coach that you're going to, is that if they themselves feel that not just in this aspect but any other aspect, like if there's a coach and if they're consciously responsible, they'll be like, okay, this issue is beyond me, right? Right, like, and then you would refer them to somebody else, right? Like,
ideally a therapist would, right? I mean, that's part of our ethics code too. But I just want to add here also is that everything doesn't have to be with one therapist, right? Like, we're talking about holistic approaches and stuff too, that you don't need to be married to one methodology, right? Because every therapist, like Marzia Auntie, is going to practice differently than I'm going to practice, for example, right? And that might work for someone, or Marzia Auntie's methodology might work because our trainings are different. But they're not your end all be all, right? So you might be contacting someone like Kaniz who's going to talk to you about the spirituality aspect, but that might not be everything that you need. But like, talking about the physical aspect or the gut aspect, right? So we're all here from like different areas. And that's what people need. It's like an entire support group cheering you on to help you out with a bunch of different things too. So one methodology might not work. One therapist might not work. Sometimes you need to look at an entire support group, right? And I think that coaches are great, therapists are great, of course, the religion, all of these aspects are great. And sometimes it's just about being part of a support group so you're heard, right? And the validation from a person who's dealing with the same thing you're going through, that you can't get from a therapist. You can't get that from a spiritual coach. You can't get that from any type of other coach, right? Or professional. So I think it's about looking at the combination of types of therapies, support groups, different methodologies, all of that stuff to give you what you're looking for, because every person's different, right? And everybody's struggle is different. And you could have someone with a personality disorder that needs all of that, right? With the psychiatrist, but even someone with that extreme end, psychiatrist isn't enough, right? The psychiatrist is going to diagnose, is going to give you the cocktail of medications, and then you're on your way. And that's not enough, right? Because research supports the combination of the two, where it's like the medicinal approach, but then there's the behavioral therapy or any other type of therapy that you're looking at.
Yeah, so it's like going to school and having different teachers who are going to pull in all different subjects and then on a whole make you a doctor or make you an accountant or make you who you are today, right? So I think that's the kind of concept that you should go to. So having said that, so if somebody's going through something, again, they need to pull from every side. Hire a personal trainer like Sayeda, who's going to make you, work hard. And then of course, connect with somebody like Kaniz, who is going to, calm you down and work with you in your spiritual aspect. But then you need somebody like Aziza as well, who is going to direct you where your gut's going, or connect with Zainab or Marzia, who's really going to work with their expertise to kind of fix things what they can fix, right? So huge deal, right? There's a lot to do, but it may sound daunting, but I think it's very doable. And of course, if you have a support system, a good support system, like let's say someone I know is going through, but again, the support system has to be really strong as well, right? And that's where, like, my next question, I guess to Zainab will be that there's so, like, a lot of times we get caught up in taking care of our family and our friends who are going through all this, and we go into this repair mode for them, and we're so focused on them that in that numbness we forget us, right? So when someone we know is going through this, how can I maintain myself, while supporting someone?
Yeah, and it's a really important thing to think about and remember, right? Because we are, as men, we're fixers, as women, we're fixers, depending on what role you play, right? So if you're in the parent role versus the child role, or the partner role, or even a friend role, we tend to take on a lot of the person that we care about and what they're going through and stuff. So this analogy hurts a little bit because of coronavirus and none of us can fly anywhere right now. But remember that time, I don't know how many months ago, feels like years ago, where we used to be able to fly places, and the flight attendant used to say, put your mask on first before you help the person beside you. Same idea, right? So trying to keep that in mind, to say, if I'm supporting someone that I really love and care about, that's going to hit me more, right, than a professional who's trying to help somebody as well, right? Because there's all this emotional attachment to that person. So if I don't put my mask on first, I'm actually doing a disservice, if you will, or harm to myself and the person I'm trying to help, because I'm not okay enough to be able to help that person. So keeping that in mind is really, really important. And it doesn't mean it has to be one or the other. And just because you're setting boundaries for yourself or looking after your own mental well-being, it doesn't mean you're dismissing the other person, or you love them any less, or you're providing them any less support. So first is just having that at the back of your mind, that I got to put my mask on first so that I can be the best version of myself to help the person that I love. Really, really important. So that means setting some boundaries, right? And that means, and this is part for both ends, but keeping promises to yourself. So if your promise to yourself is that you're going to take walks by yourself because nature helps, physical exercise helps, then keep that promise, but make those promises manageable. So it's like, well, I'm going to do an hour a day so that I'm okay. And then you don't do it. And then you're down on yourself because you didn't keep that promise to yourself. Like, it's just, it snowballs, right? So keep meaningful, easy to reach targets for yourself. Keep those promises for yourself. So again, you can take care of your own well-being. Remembering that you're not there to take on everyone's burden, right? Like, and I know all of us, well, except Sayeda, are moms, and taking on like everything you have to do in mom role, it's a lot. And we take it upon ourselves that we need to like create and raise these amazing human beings, know all of the answers, never break down. And the list goes on and on and on, right? We're not there. We're there to guide people. We're there to help our children grow up and become the best versions of that they possibly can, right? And I'm speaking to myself as a mom as well with this advice. But even when it's somebody else, like, you're not there to fix someone, right? And in my, like, the way I see it, I don't think anybody needs fixing. I think people just need help, support to be the best versions of that they can be, right? So I don't even like using that word. So you're not there to take on everybody's burden. You're not supposed to be everybody's rock. You're supposed to hold people's hand and just help them along their path, right? And giving yourself permission to take a break, like, that's okay to do. If you have somebody who's dealing with more of you know, the severity of their mental health issue, diagnosed or not, is a lot more extreme, let's say, find a support group. So Facebook's a good place to go. Even if you start on Google, for example, talking to people who are also supporting someone else, right? So there's, for example, when we talk about like mind and body illnesses, there's cancer support groups. When somebody has an addiction, there's support groups for family members who are supporting someone with an addiction, for example, right? So finding a support group, because again, if I can hash out some of the stuff that I'm going through with somebody who can relate to me, right? I have this motto, right? It's a problem shared is a problem halved. So kind of sharing and talking about some of that stuff with somebody who can really get you is really, really helpful, right? And then and ask for help, right? Just as we kind of expect that of the person we're helping, like we're teaching them or helping them ask for help. That takes a lot of courage, right? So if you are in that role of helper, supporter, fixer of all things, right? The person who has all of the answers, then ask for help, because we really can't do it on our own. And remember that your job is not to obviously enable anybody, but our job is to help people learn to help themselves.
Yeah.
Right? You're doing a disservice if you do everything for that person. If you completely pave the way, they're not going to learn the skills, right? And then you start developing different types of attachments, which are toxic, right? So really our job is to help them learn how to help themselves, whether that's your kid, your partner, your friend, your parent, whoever that relationship is with. So yeah, look out for support and ask for help if you need it. And be aware, right?
And I think also connecting, like staying connected spiritually too, like would kind of really help, right? For some people it helps, you know, being, if you're strong spiritually, I think then providing that support system to somebody who's going through it is also very good. I'm going to quote another one of Imam Ali's quotes, and it says, "Do not let your difficulties fill you with anxieties. After all, it is only in the darkest nights that the stars shine more bright." So Kaniz, how does meditation help one connect to the spiritual self? And how can this lead to find yourself be better and stronger?
So it's really important to remember that we are spiritual beings having this human experience. And so, you know, going through certain emotions is all part of the human experience. So what meditation does is when you close your eyes, you're shutting away all the stimulation from your environment, and you're connecting to your soul, to your spiritual self, your inner world within. And because most of the time we are, you know, so busy being busy, trying to just make things work day to day, do the things that we need to do. We're so focused on our external world that even if we're going through pain within, we're not connecting. We're not like allowing ourselves to feel that pain or even acknowledge that we're going through pain. But when you do meditation, you're really connecting with yourself, and you're allowing yourself to feel. You're allowing yourself to familiarize, you know, what emotions are coming up, what some of the triggers are in your life, how you're thinking. You're getting really familiar with your thoughts and your feelings. And I think once we really begin to familiarize ourselves with our inner world, then we can actually, you know, take action. Once we've acknowledged and we're aware of what it is, then we can take action. So meditation really helps us connect to ourselves. And I think what happens is, you know, having this human experience, we disconnect many a times to who we are, how we feel, what we're thinking. And so it really allows us to integrate into the spiritual and physical self. And meditation personally has really helped me because it's helped me connect to my heart and to my intuition. It's helped me slow down the overthinking mind, because the mind is, right, it's like constantly, you know, creating so much noise and like overthinking, overanalyzing every single situation. And it's just helped me calm my mind down so that I can really get in touch with my heart, my intuition. And that's helped me take inspired action where I'm like, I, connect to God, because God is within us, and the heart is the seat of your soul. So just kind of, connecting to the guidance that's coming through, asking God for help, because, he has given us so much free will. And when we say yes, when we ask, it is given to us. So coming from that space of awareness, acknowledgement, acceptance, and having the courage to say, yes, God, I need help here. I'm not feeling good. And when you set those intentions, like, the help does come. It may come in through a book that may fall off a shelf. It may come through a conversation you'll have with someone. It will come through like a video or something that you will come across that is showing you that God is with you. Yeah. And, he's helping you through this, and there's signs all around you.
Yeah. I mean, just, I think a week or so ago, something had happened, something rather silly. And I went to bed thinking about it and, having a little bit of a heavy heart. And I woke up in the morning and I did my thing and I opened up my Instagram, and I kid you not, the first meme that came up, I was like, whoa, is this true? Like, is this really, like, it was in the moment, you're just like, but then I used to have that kind of reaction before a lot. When something would happen, I'd be like completely like thrown off. And now I'm like, yeah, okay, I got your message, God. Like, I got it. Like, out of all the algorithms and out of everything else that can pop up on my screen, if I get that message when I open it up, I'm like, okay, I'm good. And it can come in the form of a cake too, right? But Aziza, do you really think that cake that comes to you as a gift is a good thing for our gut? Like,
depends on what's in it.
so I'm going to take this whole cake situation and ask you, like, how can we support our gut in order to improve our mental health? Like, if that cake really comes to me at the time when I'm really feeling low, should I just sit there and finish the whole cake?
So, I'm gonna take a different take on it from because we talk a lot about what we eat, right? And how that affects our gut. And a lot of people know about healthy eating, like, about the gluten-free and all that stuff, right?
Mm-hmm.
What I want to really focus on, and because I want people to realize that gut health doesn't have to be complicated. It doesn't have to be about probiotics and supplements and any of that. It really is about how we eat, because what we eat is just as important as how we eat. And sometimes I think it's more important to focus on how we eat. Because what happens, that the biggest problem with the gut happens when our digestive systems are not working well, right? Our digestion is delayed. The food's not moving through properly. We're not emptying out our guts properly. And that happens because of not what we eat so much, if how we eat. And what do I mean by that? A lot of us are used to eating on the go. And that's probably the worst thing you can do, and Kaniz talked about meditation, and if you really don't want to do meditation, start doing mindful eating, because that's really focusing on your food while you're eating it, right? Because a lot of our digestion actually starts with what they call a cephalic phase. That's the phase that happens before we even put the food into our mouth, because you should be salivating. You should be like looking at the food, and when Islam has all these things, and a lot of ancient wisdom, Ayurvedic, Chinese, they all talk about focusing on when you're eating, the energy you put into it, the energy you put into cooking. Like, a lot of us are not, we're not preparing our food so much. So we're not, so that cephalic phase starts from when you're preparing. The smell, the look, all that should have our digestive system going. In fact, what they say that the 30% of the acid production actually starts before you even put the food in the mouth. So the better your acid and the enzyme production is, the better you'll digest your food, right? Number 2 is chewing. A lot of us are not chewing. Even, I notice my kids, they'll be like eating so fast. They say you should chew so much that it should be like baby food in the mouth, right? And when you chew, our digestive system gets a kickstart. Like, so when you're chewing, the brain is sending a signal to the stomach that, okay, start releasing your enzymes, start releasing the acid, and that helps with the digestion, right? So and as you're digesting well, it moves through the system well. If there's too much food sitting around for too long, that's when the bad gut bacteria start growing as well. So there's a lot of, there's a lot, you don't really even have to, you can eat that cake, eat it mindfully. Don't eat it with guilt. A lot of the energy you put into will make a difference. So eat that cake. That's okay.
It's funny. I gave you the reference of the cake, but anybody who knows me knows me. I'm not a dessert person. For me, it's the fries.
The fries. Well,
every fries that's what I'm going to do. I'm going to say, Aziza said, take your fries, smell it, enjoy it.
And if you actually do the exercise, you'll actually notice that you're salivating. You'll notice, a lot of times when we don't eat and, we just grab a granola bar and on the go, it's better probably not to eat anything, and again, that's another thing, having those periods of not eating. And that, you've mentioned intermittent fasting. It's amazing for the gut because you have a huge amount of time and that there's nothing going in the gut, which allows it to process all that, stagnant food. And that helps the gut keep moving. And that's actually beneficial. So you don't even have to, I don't want to leave you with a whole bunch of stuff because it's hard to change your diet. But if you can just change how you eat, that would have an impact on your brain health. Right.
And I think you're right, tying in the intermittent fasting, because I start eating at 12, and from 11 o'clock, I'm like, I'm like thinking about that cup of chai, and like my meal. I'm really literally like I'm at work and I'm oh my God, stop, right? So I think it's good because I'm getting my my enzymes flowing and everything. By the time I sit and have it, I enjoy it, right? Yeah. So last question quickly to Sayeda. I am so loving this that the hour has gone by and I'm like, oh my God. So Sayeda, what can somebody do or what would you recommend for motivation or energy to do something when they're going through, like, what is the one thing that you can do, or what would you recommend? How can we get off that couch?
I know it sounds crazy, but you just need to get off the couch. You may not want to go on the walk. You may not want to work out, but statistics also show that your overall mood, the way it improves after your workout, even if you didn't want to do it 30 minutes ago, it drastically changes. And what that does is the endorphins that I mentioned right before, it actually helps you to continue to stay active because you like the way you feel after workout. Why wouldn't I want to feel like that again, right? And then you get that cycle and then you become a personal trainer.
Wow. So I know that if I change into my workout clothes, then I think for me, that's one of those things. So if I'm wearing my workout clothes and I'm like, I've worn them, I may as well just go for a 5-minute walk, right? Like, even if it's 5 minutes, So whatever it takes to get motivated for anything at all.
Or if it's an energy drink, anything like that, you're right. The workout clothes.
Sometimes we think of snacking just as eating, but you could have a movement snack as well, right? Exactly. You don't have to go on a whole walk. You could just do 5 jumping jacks and then you are officially moving.
That's a good one. It's like just have a quick snack, right, of a workout. That's something to think about and to act upon. So I think this was really good, and I think that everyone at some point or the other needs help, right, in their lifetime, and I think that help does not mean betrayal or disconnection, because that's a lot of times that's what it's kind of labeled as well. It simply means that we're all unique, that we all process life in our own ways, and some of us are just wired differently. Right. So to provide that support and to get that help and just to take action or recognize that I need help or somebody needs help, and to provide that's what's important. And there's one thing that I do want to add is that even myself, I often burdened gratitude to fix many issues, right? Like if there's somebody going through, why are you feeling this way? Or, you should be grateful, you have this and you have that and blah, blah, blah. And I think that, and I think I posted this and it really did, like I connected with it, that, gratitude is a supplement for our soul. And we should not confuse that with an antidepressant or an anti-anxiety medication, right? Like it cannot fix, just gratitude in itself cannot fix those things. So on that note, this was an incredible session, and, we were able to touch so many different aspects of mental health. And I hope and pray that, people who are listening to us today, they were able to benefit from it. I would like to thank all my guests today for spreading such positive insight on mental well-being. If I don't know if anybody wants to add a little something as we conclude, I can open it up, or to anybody else who wants to say a little concluding something.
I want to thank you, Mama Khwaja, for starting this discussion, right? Because you brought all of us together, which is lovely, but that bringing us together is what was needed, right? So individually we're strong, and then we're even stronger together. So I think it's great that we're having these conversations. And so thank you for doing this and opening up.
You're welcome. I truly do. I'm grateful for all of you for making time on a Sunday afternoon and showing up. If everybody who's watching, do not follow us all on social media, do that, because, you have access to all these people who can give you all this great information. And you don't have to sit down, and attend a call like this or a session like this. You can do it in your own time. So if you don't follow, I can always send the links back on my Instagram. Do follow my YouTube channel, and I also post podcasts on Spotify. And if you have any follow-up questions for any of our of the guests for today, do not hesitate. You can DM me directly, or when you follow them, you can DM them directly, and they definitely can give you all the information. And, I'll just leave you with one last thought that, some people are suffering and you'll never know because they suffer in silence. So be mindful when you're around people, be kind, and be helpful. So thank you so much.
Thank you.
Thank you.
Thank you. Thank you.